Nurse adopts preemie she helped deliver after birth mom cannot care for him. In most cases, doctors do not know what caused a baby's birth defect. When the cause is known, it might be environmental, such as a baby's exposure to chemicals or viruses while in the womb, a problem with genes, or a combination of these things. But what happens when your child isn't born healthy? What happens if, like me, you were born with a disability? For people who want to become parents, it is important to know that some birth defects can be prevented during a woman's pregnancy. Claire Mills always knew that she wanted to be a mother. She just never expected it to happen this soon, when she was still a 25-year-old single woman. Claire is an ICU nurse who just bought a house in Sugar Land, Texas, and has been working 2 jobs to pay the mortgage. She loves her job because it gives her the chance to be around babies all the time, and she works very hard at it. Claire never expected her entire life to change forever when she helped to deliver one newborn. Back in May, Claire was just in her 2nd week at Houston Methodist Hospital when she was called to help with an emergency cesarean section. Her team was then able to deliver baby Jackson, who was born prematurely, weighing just 3 pounds and 10 ounces. Though Claire has worked with tons of babies, this one just felt special to her. A congenital disorder is a condition that is present from birth. The primary cause is premature birth, being born before 37 weeks gestation. A baby born early has less time in the mother's uterus to grow and gain weight, and much of a fetus's weight is gained during the latter part of the mother's pregnancy. Another cause of low birth weight is intrauterine growth restriction. This occurs when a baby does not grow well in utero because of problems with the placenta, the mother's health, or birth defects. Babies with intrauterine growth restriction may be born early or full term. Premature babies with that may be very small and physically immature, and full-term babies with that may be physically mature but weak. He just felt very familiar to me, she said. I feel like I know him. Over the next few weeks, Claire bonded with the baby's mother, who had complications during birth and was struggling. Claire was heartbroken when the mother was discharged on her day off. I was so hurt I cried, she said, but I called the social worker and asked if there was anything I could do to help support the mom. Words of this eventually reached the mother, who at the point had realized she was not financially able to take care of Jackson and wanted to put him up for adoption. In a moment she felt it was a sign from God. She asked Claire to become Jackson's mom, and Claire said yes. She knew right away that it was meant to be. Of course, things were not easy for Claire, as she immediately became a single mother. With her own mother's help, however, things have been going well, and she absolutely adores her son. Claire is always a helpful, broad-minded, and soft-hearted girl. She likes to pass her time with the child, and she can fight it that she is able to take care of Jackson. I cannot remember what my routine was like before him, Claire said. Claire wants to make it official soon. Now she's just enjoying her time with her 4-month-old son. At prenatal visits, the health of both the mother and the fetus should be checked. Prevention of preterm birth is one of the best ways to prevent babies born with low birth weight. Prenatal care is a key factor in preventing preterm births and low birth weight babies. Thank you for watching. Tap one of the 2 videos on the screen for another ultra trend story every day.